Hello folks, I want to talk about Swaziland and AIDS. The cure for AIDS is well known. It's called PEP treatment. The problem is most blood tests take too long, matter of fact all blood tests take too long to detect virus in your system to allow you to use PEP treatment to cure yourself. PEP treatment has to be initialized or administered initially within 24 to 48 hours or as soon as possible. Normally no longer than 72 hours. After 72 hours, it's almost useless. But I figure about 48 hours because that's about 100% cure rate. Now, why do I say this now? Why am I looking at Swaziland? Why not another country in the world? Because Swaziland was the worst affected. And guess what? The HSV patient hive load is about 75%. That means of the HSV patients, 75% of them have hive, which causes AIDS. Now, what does that mean? Well, HSV can be easily noticed by sores in the groin. Fairly easy to notice. It's about 50% effective because there's sometimes, not always do people show sores, but most of the time they do. Particularly if they have hive or AIDS. Because hive and AIDS reduce the body's defenses, allowing the zoster virus or herpes simplex virus to fester and to show more and longer and usually more extensive breakouts. And there are shorter times between breakouts. Whereas without AIDS, it hits you for a couple of weeks, it's gone for a few months, hits you again a little bit, not quite as bad. Then it's gone for a couple of years, and then it hits you again, then you pretty much forget about it. With AIDS, that's not the case. If you're infected with hive, it'll go away after about 5 to 8 weeks initially. About a month or so later, it'll come back. It'll be worse than it was the first time. It'll go away for a little while, come back even worse than it was at that time. That's one of the things about it. If you're not taking medicines to suppress HSV and HIV, then HSV, when HIV is present, gets worse with shorter times between outbreaks and longer and more severe outbreaks. So though not perfect, unlike what the CDC tells you, which is dated information, they tell you there's no way to tell if somebody has the AIDS virus. In some countries, the percent of HSV victims that have HIV is only like 1 or 2%. And the CDC is right in countries like that. But in Swaziland, they have a 75%. That's enough to be willing for me to actually come out and say, oh, well, hey, that means if you see that on a lover, more than likely you just got exposed to AIDS. It's more than a flip of a coin percentage. Flip of a coin is only a 50% chance. You're talking about a 75% chance. That's 50% more chance than a flip of the coin is. 75% chance you'll be right in Swaziland. Now, there's a couple other countries that are just as bad in Southern Africa with the AIDS virus. They also have high saturation rates of the AIDS virus within the HSV population. But when you get out of that area, it's low saturation. I don't know why that's the case, but it is. There happens to be HIV-1 throughout most of the rest of the world, and there's a different strain of it in Southern Africa, but you'll have to have some professional study that. I'm just studying the figures, the percents put out by the WHO, avert.org, and CDC in the United States. They say that 27% of adult population in Swaziland has AIDS. Now, according to the University of Washington, I could go through this. You can go to my previous video on Swaziland and HSV and HIV 1 and 2, or you can go back to my the AIDS exposure test and AIDS cure, and you can get some of that information. It's in the video. I put sites and everything on the video itself on a chalkboard, and went through it there. So if you want to go to my site, or after you get to do this, read this one, hit my face on the side of my thing, it'll take you to my channel, and you can scan through all the material I put up over the matter. But basically, that's it. I mean, in most countries, you can't tell if somebody's got the AIDS virus. But in Swaziland, so many HSV victims have the AIDS virus, and so many people with the AIDS virus have HSV, that they're almost synonymous with each other. They're like married couples for all practical purposes. And them being virtually married to each other in that particular country means you can actually use it as a test. It takes 10 seconds of your time, and you can determine whether you're at high risk of being exposed to HIV. If you don't already have HIV, then you should immediately seek medical attention and try to get some PEP treatment. PEP treatment, if taken within 48 hours, has almost a 100% guarantee that you will not have HIV after the 4 weeks of medicine. If you wait 2 weeks for the rapid test, it does you no good. If you fail the rapid test right then when you go to the emergency room or to your doctor after having that sex, and you fail it, PEP won't help you, because you're already infected too long for it to help. That rapid test takes 20 to 40 minutes to test you. But what they probably don't understand about it is that is not 20 or 40 minutes from the time you were infected. That's 20 or 40 minutes from 2 weeks of being infected. It takes 2 weeks minimum to show a positive result. Think about that. 2 weeks to show a positive result. So taking that test the next morning does you no good. You have absolutely no idea, unless, of course, you have the AIDS virus. Then, of course, it doesn't matter. It's too late. But if you're exposed to the AIDS virus overnight, and you come in there and you don't fail the rapid test, then take PEP treatment. It can keep you from catching HIV. Well, that's PEP, and that's me, Thomas Willis, out here. Have a good day.